Good afternoon, morning, whatever time of day it is for you. Wausau Mayor Katie Rosenberg here with my friend Laura from the health department.
Hi, Kate.
Hey, what is your official title?
I'm a health educator at the health department.
Okay, so you know all the things. But the good news is we're only going to talk about three things today because that's our new thing. Three.
Three public health things you need to know this week.
Yes, I'm super excited. I know I've been bugging you and your folks at the health department a lot because I want to do these videos and get as much information out as we can. And you talked me into maybe making it more manageable. So thank you. The public thanks you. Appreciate you.
Hey, that's why we're here, to help out, to educate the public. So what can I help you with? What are your top three questions this week, Katie?
Okay, so obviously the hot topic, vaccines. They're getting out. I see that Wisconsin's getting even more vaccines out, but I want to know who makes decisions about who to vaccinate?
Oh, that's such a good question because we get a lot of calls here at the health department because people are like, Laura, you should make this person go next. And I'm like, I don't have that power. And thank goodness. But there's actually like a bunch of different committees that have influence on this, and one is a federal committee, and it's called the Advisory on Immunization Practices, and we actually call it ACIP. So Advisory Committee on Immunization Practices, and you can search for it, and you can see that it's like a bunch of like medical and public health professionals that decide, ethically, how should we approach giving out vaccine when we don't have enough to give out fully yet. On a statewide basis, we have what's called the State Disaster Medical Advisory. And
I've heard of them.
You heard of them? They are, so again, they're medical and public health experts. And for the state, they had the really difficult task of like figuring out, we only have so much vaccine, like how can we give it to the people that need it the most? Like what is our ethical responsibility as humans? And so, there's very specific groups that are eligible for the vaccine right now, and they decide that. So if, I think we get a lot of calls because people want it to be locally decided. I don't know if you've gotten any calls.
Oh, so many calls. People want me to advocate for this or that. And, we actually did advocate for some groups of people, especially our vulnerable populations. It's so important. And I love that you're talking about ethics. I'm not going to ask you about it for this three things, but maybe for a future one, we'll talk a little bit about biomedical ethics because that's kind of my jam. But yeah, totally. Okay, so the state, the feds, and then what do you view your role as? Just kind of helping people understand where they fit in those?
Yeah, our role is really what we're trying to do at the health department is to educate people about what group is eligible. So right now, 65 plus is the most recent group that is eligible. So if you're over the age 65, time for you to take a look at, how would you get vaccinated?
Okay, so you just kind of led right into my second question. I have a lot of folks who are over 65 and they're registered, but they're also nervous seeing tens of thousands of people on these lists, and they're afraid they're not going to get their vaccine. So how do we know when they're going to get their vaccine? What should they do? Also, what about the people who've registered so many times with all the different health systems? Maybe you can just walk us through, like, what should somebody who's eligible for the vaccine right now be doing?
So it sounds like there's a couple of different things that you asked there. So it sounds like if they've registered already, my response to that would be just be patient, because there's 24,000 individuals in Marathon County that are over 65. And just to give you a sense of it, in the first 3 days after it was announced that over 65 were eligible, one of the local healthcare systems got 600 calls an hour.
An hour?
Yeah. So it's fantastic that we have the opportunity to get vaccinated, that population vaccinated. It's just going to take some time. And so we're asking people, if you register, please only choose one system and register with that one system. And then you only have to do it one time. I think that people have been doing the registration again and again because it's not a very satisfying process. You don't end up with an appointment necessarily, but they will get to you. They will call you. You are on a list. And so for people who haven't registered or called anybody, my recommendation is that they call their primary care provider or their healthcare provider. In Marathon County, we have a lot of people that either go to Bridge Community Health Clinic, or they go to Aspirus or Ascension or Marshfield Clinic. All those individuals, all the individuals at those places are vaccinating. And so you just give them a call, or if you're internet savvy, oh yeah, go on the internet or have somebody that is. So, I've been hearing a lot from people who say, I helped my grandma register. That's great. That's wonderful. That's what we want.
I love it. Okay, so another thing, we're kind of heading into that March 1st date when it opens up even more. So I'm married to a teacher. I also am hearing a lot from teachers, from, I don't know, food service workers. How do they know when they're going to get their shot? Can they just walk in right away on May 1st or March 1st and get that shot?
Well, I wish I could say yes, but the difficulty is that there's just not enough vaccine to go around right now. We're not getting in Marathon County, the places that do vaccinate are not getting the vaccine that they're asking for. So every week or so they ask for a certain amount, and most of them are not getting the full amount that they're asking for. And so really we're very focused on the 65 plus population. And why are we focused on them, right? It's because they're very vulnerable to the COVID virus. They're one of the most vulnerable populations. And so we want to make sure that they are taken care of. And so, while I wish we could open up the doors and say, okay, everybody come in, it's March 1st, it's probably not going to be the case. So, you can, again, if you're a teacher, if you're other groups in this next group are teachers, food service, childcare, Medicaid, long-term care programs, some public-facing essential workers. If you want to know what that is, we have information on our website. Non-frontline healthcare, and then people in congregate living. So us at the health department, we're really focused on the most vulnerable of those populations. And so, once we get closer to March 1st, my recommendation is just keep your eye on the news, keep your eye on Facebook. We also have a system through the county, Katie, where you can get texted every week. Ooh. About, are you who are the eligible groups and where do I go and how do I register? And that's, nope, wrong side. See, look at, I tried. That's the county. And this is the website up here.
Perfect.
That's our website. And you click on the blue bar after you pull that up, and you'll get directions on how to sign up for that.
That's awesome. I actually did sign up because you mentioned this to me last week, and I got alerts about the snow also. So awesome. Got all kinds of alerts, and it helped me stay in the know here, but I'm waiting impatiently to find out more information as we move on about vaccinations.
Yeah. Well, we send out periodic updates.
Love it.
Yeah.
Okay. Yeah. So what am I missing? Anything related? So we have to be patient, which I know is tough. We have to make sure we're paying attention to the news and your website, sign up for text alerts. And then also, we probably still have to continue wearing masks and social distancing, right? There's no way around it.
Yeah, that's a really good point, Katie. Yeah. We recommend continue the same things that we've been telling people: wash your hands, social distancing, stay 6 feet apart from other people, wear your mask. Please wear your mask. I don't have to tell you, you have cool masks.
I know. I have quite the collection growing, so I might be wearing them for a while here.
Will you show us? Can we do a 3 things where you just show us your mask fashion show?
Sure. Yes. One of an upcoming 3 things. I will show you some amazing mask fashion that I've discovered.
Sweet. I'm looking forward to that. Well,
awesome.
Thank you, Katie. Will you think of more questions for us?
Oh, yes. I will be back next week, if not earlier. Thank you so much.
The phone call earlier. All right.